Peyronie's disease gets talked about almost entirely in clinical terms. Curvature, plaque, treatment, options, and all of that matters. But for most of the men I see, the thing that sits heaviest isn't the clinical picture. It's what the condition is doing to their relationship. The gradual narrowing of intimacy, the positions that quietly get dropped, the conversations that don't happen, the partner who can sense something has changed but doesn't quite know what. So this video is about that, the relationship dimension of Peyronie's disease, which doesn't get nearly enough attention. Here's what the evidence shows. Research looking at both men with Peyronie's disease and their partners found that 40% reported a deteriorated couple relationship as a direct result of the condition. Sexual desire fell in 86% of men. Their partners reported significant effects on their own satisfaction and well-being. And many men facing the combination of pain, embarrassment, and anxiety about their partner's reaction responded by withdrawing from intimacy entirely, not because they no longer wanted connection, but because the territory had come to feel too fraught. The withdrawal tends to follow a predictable pattern. First, sex continues but becomes increasingly managed, certain positions avoided, certain moments cut short, then initiation gets less and less frequent, because the anticipation of difficulty has made the whole area feel loaded. Then physical affection narrows more broadly, and the partner, without the explanation, draws their own conclusions about what the withdrawal means. That's where the real relationship damage happens, not the curvature itself, but the silence around it. So what actually helps? Two things, and both matter. Clinical treatment to address the physical condition, which for most men with Peyronie's disease includes focused shockwave therapy to reduce pain during the active phase, address associated erectile difficulties, and where possible soften the plaque over time. And an honest conversation with your partner, which doesn't have to be a medical briefing, just enough to convey that this is a physical condition, not a loss of interest, that it's something being addressed, and that the withdrawal has been about the pain and the anxiety, not the relationship. Partners who understand what Peyronie's disease is and what it doesn't mean about attraction consistently cope better than those navigating it without that context. And many men find the most valuable thing they've done is bring their partner to the assessment with them, where both of them can hear the clinical explanation together and start addressing it as something they're facing together, rather than something one of them is carrying alone. If you'd like to understand what your options look like and what treatment could realistically achieve, a free confidential discovery call is the right first step. Partners are welcome at any point in the process. The link is below.